Hi everyone, I'm here today with Becky Livingston, and she is a labor and delivery nurse, and she's going to talk to us with baby Graham about getting pregnant, her journey of becoming pregnant, and also her birth story and breastfeeding. So Becky, how are you?
I'm good. How are you?
Good. So tell me a little bit about yourself.
I am 32 years old. Like you said, I'm a labor and delivery nurse. I have been for almost 10 years. I've moved around a lot. I was in the Army, first as a nurse, and then I've settled here with my husband, Tio, and we've been married for 3 years.
Excellent.
That's it.
That's perfect. How long were you thinking, like what was your plan once you got married? Were you thinking, okay, I want to be pregnant in the next year or two? What were your initial plans?
We pretty much went into our pregnancy or our marriage knowing that we wanted to get pregnant pretty soon because we'd been together for a few years before we got married. So we knew pretty much right away that we were going to start trying.
Okay. So right after you got married, you did start trying.
We did.
How was that process?
We had some trouble getting pregnant, so we went to see some doctors when we lived in Alabama. Yes. To help us get pregnant. We started out doing IUIs, which is intrauterine insemination, where sperm is directly implanted into the uterus to kind of bypass the whole getting to the egg, through other ways.
Yeah, through the
So we started with that, and we were successful the first time that we tried in Alabama, so we were very happy. I felt fine. I went for my first ultrasound and was very surprised to find out that I was pregnant with twins. And they looked like identical twins, so I had again been feeling fine. They were following my hormone levels, and they seemed a little low. I could tell that they were a little concerned, but they had stopped checking them, so they said, okay, well, you can make your appointment with your regular OB, and good luck. So
Wow.
That's what I did. I worked, obviously, on labor and delivery, so I made an appointment with the doctor there, and I was like, I feel great, should I come back in like a month? She's like, yeah, sure. So its first ultrasound was 7 weeks, and there were 2 heartbeats, and everything was great. And I continued to feel fine, a little nausea, a little tired, but nothing out of the ordinary. So I went to my first appointment with my OB at 11 weeks, and neither baby had a heartbeat anymore. So I had what's called a miscarriage, where you've had a miscarriage, the babies are no longer alive, but your body hasn't really caught up with that yet. So it was a decision I had to make how I wanted to proceed. And they recommended either a DNC or to take some medicine at home, and I opted to stay home and take medicine. So that's what I did to help my body realize what was going on. That was a whole, ooh, goodness. Excuse him. That was obviously a terrible experience to go through, but I wanted to experience it myself and not have surgery if I didn't need to, so that's what I did. And everything went pretty uncomplicated that way, so then we started trying again, but with schedules and sometimes making too many eggs or having cysts, or it was every month was something different down there, so we ended up moving up here to Connecticut and had to restart the whole process.
Yes.
With different insurance, different doctors, different, all that kind of stuff. So that's when we came up here and found a new doctor who was wonderful and was really great, helping me process that I had had a miscarriage, and offered to send me to see a psychologist that he really liked. And I just really felt very connected with that group of people that I saw at that office, and they worked with me to get pregnant again. It took 5 more tries this time to get pregnant. Five, which when it seems like everybody else is pregnant around you, that it starts to be really hard. Every month you feel like you've miscarried again because you know that there should be a baby and there isn't. So that started to get a little trying and
hard.
It was hard. But then finally, on the 5th try, we got pregnant with Graham. Only 1 baby this time, and
here he is today.
And here he is. So pregnancy was a little more stressful this time, but
yes.
But we made it through.
So tell me a little bit about so the miscarriage of the twins. You were about 10 weeks.
I was 11 weeks gestational wise, but they had stopped growing, I think, around 9.
Okay. And did they give you any explanation?
They didn't. I didn't opt to have any kind of testing done.
Yeah.
In my mind, it was, probably chromosomal since they both died and
Right.
they were identical. And my levels really weren't where they should have been now that I look back. Like, I look back and I say, well, I should have known.
Right.
That's how you feel. Like, I should have known something was wrong.
No.
But, yeah, that's how I still feel about that. But,
Well, I can understand maybe hoping, or maybe there was like some sign, but they didn't really give you
I never
a
had
reason
yeah.
to doubt.
No, yeah. I never had a cramp. I never had any bleeding. Nothing. So I just...
Right, and these things can happen unexplainably as well. And in fact, about 25% of pregnancies will end up in miscarriage, and that number might even be higher because women don't necessarily always know that they're miscarrying.
Mm-hmm.
It could be like, oh, I had a late period, and the pregnancy just didn't stick. But you might have actually been pregnant and then just passed your lining, and it would have turned into basically a period. So it's really common, but it doesn't make it any easier, especially when you did go through, some difficulty right from the start to get pregnant, and it's a roller coaster of emotions.
It is, yeah.
Yeah.
And then, of course, in my job, I'm around pregnant people all the time.
Right.
Some of them who might make you angry with the way that they treat their pregnancy or their baby, and you get a little down on yourself. But I had a great support system of coworkers and friends and family. I didn't really go public with it until the following October, which they were due October 8th, and October is Pregnancy and Infant Loss Awareness Month. So
Yes.
I went public with it then on Facebook, and I just really had an outpouring of even more support from people I went to high school with who I don't really talk to anymore, acquaintances and that kind of thing, who they've gone through the same thing, and they hadn't really told anybody before. They weren't, really open with it, but said thank you, for saying what you did. And, I lost a baby 20 years ago. I had someone come and say to me, and it's still, tomorrow will be 2 years since I miscarried. And I feel like now I have, Graham to be joyful about, but I still think about them and what my life would be like with 2 babies. I'm like, wow, this is hard with one.
Right.
Like, it would be crazy with 2. But it's a craziness that I would have welcomed. And but I know if they were here, then he wouldn't be, and that would be different too. So it's kind of, you were very talkative today. So
Yeah,
it's just
sort of
bittersweet.
poignant,
Yeah.
with tomorrow being the anniversary. Well, thank you for sharing that with
No
us.
problem.
So tell us a little bit about the journey of getting pregnant with Graham. I know you had to go through 5 more IUIs.
Yes.
I guess we'll start real basic. Are IUIs painful to have done?
They're not. It's like a pap smear, a little bit longer maybe than a pap smear. My doctor uses a speculum, and most do. The doctor in Alabama used an ultrasound at the same time to make sure that the device that puts the sperm where it needs to go is in the right spot. But this doctor did not. Some doctors make you have a full bladder. Some don't care either way. Goodness. So it just depends on the doctor's preference. And, at first I was like, why isn't he using an ultrasound? Doesn't he want my bladder full? Because that's what got me pregnant the first time,
Mm-hmm.
And the first 2 IUIs I did natural. I didn't take any medicine for it. Just tried to monitor myself, for ovulation. And turns out my periods were a little longer than most people, 32, 34 days sometimes. So then after the first 2 didn't work, we went ahead and took Clomid, which I had done with the twins. I didn't really want to be pregnant with twins again. I didn't want a high-risk pregnancy.
Correct.
I didn't want a C-section. I didn't want, I wanted to reduce the chance of having twins if possible.
Makes
and
sense.
Clomid increases your risk by about 25%, I think, 20%, something like that. So the first 2 I did without. And then the next 3 I did with Clomid. So I had 2 eggs every time. So there was always a chance that I'd get pregnant with twins again.
Wow.
And so you go in, you get ultrasounds when it's coming up to your period. You get one at the beginning of your period to make sure you don't have any cysts or anything and everything's looking well. And those are all transvaginal ultrasounds. So if no one's had that before, then if you haven't had that done before, it's,
Yeah, a little bit proby.
it's a log probe inside of you. But if you're sexually active person, it might not be that surprising to you. It wasn't painful for me, but maybe it is for other people.
Yeah.
And then they say, okay, we'll see you at day 14 or day whatever, and check on the follicles, and then because that's about, when you should be ovulating. For me, it was a little later because I have longer periods, so I'd go in day like 17 or 18. Okay, sir. So you go in, you get blood work, you get ultrasounds, and then they're like, oh, not time yet. Come in 2 days, and we'll do it again. Blood work, ultrasound. Oh, you're ready. So then you have to give yourself a trigger shot, which is just a little itty bitty needle. I give it to myself in my stomach.
Oh, okay.
And it's HCG actually, right?
Yes.
Yes, I haven't done it in so long now that I forget. But it's actually that pregnancy hormone, and it causes the egg to be released, or eggs, and it gives them a more exact time period to bring you in for your IUI. So usually a certain amount of time, depending on the dose of HCG that you give yourself. You go in and they put the sperm in.
Yeah.
And then you sit there for 15 minutes, and then you go home and you go about your business. And in 2 weeks, you come back for a beta HCG, which is the exact amount of HCG in your system. Anything over 50 is normally pregnant for those offices. And for him, mine was 64.
Yay.
And then they check it sometimes every 2 days, every 4 days, to see if it's doubling appropriately. And for him, it finally was. And I felt really good about the numbers when they were calling me. But it's still, still very
stressful.
Especially when you've had a miscarriage where you had no signs that you were miscarrying, So the first ultrasound, we couldn't really see him yet because it was only like 5 or 6 weeks. So you just saw the little yolk sac and, the spot where he'll be eventually.
Yeah.
And I was like, I don't feel good about this yet. So then I came back in 2 weeks at 7 weeks, 4 days, and there he was with his little heartbeat. So I have a picture of,
wow.
his very, very first.
Yeah. From the
picture.
moment you could see.
Pretty much, yeah. And it's fun, you know exactly when you got pregnant, I don't know.
Yeah, your exact due date.
Yeah. So we don't have to wonder about any of that. But yeah, that was, I went to a smaller practice that I really liked. I only saw one doctor the whole time. And for me, that was important, that he really knew me, and I knew the staff, they'd know me when I walk in, and, it's that was my personal preference.
Yeah. I know that you had a really hard time getting pregnant, and now I would like to know what your expectations of, delivery was. I know you have so many years experience being a labor and delivery nurse, being an Army nurse, being a nurse in Alabama, and now being a nurse in Connecticut. What were your hopes for Graham's delivery?
I hoped to have a healthy, easy delivery, essentially. I've seen a lot of things go wrong, obviously, in my work, and I really didn't want any complications if I could help it. So I tried to stay healthy during my pregnancy. I didn't gain too much weight. I stayed active, stayed working, kept moving around, and just tried to concentrate on being ready as much as possible. I thought I would have 2 more weeks to become more ready for delivery, but I didn't have 2 more weeks. So I just expected or wanted to have as natural an experience as possible. No induction, no monitoring as little as possible, that kind of thing. So.
Okay. So did you go into labor at 38 weeks?
I did. I did go into labor at 38 weeks and 2 days.
Wow.
Yeah.
And was it natural? Did you just...
I did. I was at work on Friday night. I worked night shift, and I worked all night, and it was really busy. And I said to the doctor who was doing most of the deliveries, I said, "You are going to put me in labor." Ha ha ha. And I felt fine. I didn't have any contractions at work. I went home. My husband was home from break from school, so that was very convenient. He had just gotten back the night before.
Wow.
Yeah, so I couldn't have really timed that any better. So I came home, tried to get some rest, and I slept until the afternoon. And then I started waking up like once an hour with some pain. And I attributed it to that I worked too hard the night before. We just kind of in denial. And so I was like, I just need to drink some water and go lay down. So I kept drinking water, laying down, waking up again with more pain. And it was lower. I'd never had any pain low. I'd had, felt contractions up top, but those Braxton Hicks, and they never really hurt. But this was kind of painful, like a period cramp, like they say it would be. And but just once or twice, and then I'd go back to sleep and rest. So I didn't really think much of it. I was supposed to work at 11 o'clock that night. And so I was like, well, if it's gets worse, then I won't go to work, but I never call out. So it's like, I'll go to work if it's still like this. I can work through this,
That's determination. Dedication.
Yes. And so, like, I took a shower. I felt okay. They were maybe a little more frequent, but I still wasn't thinking much of it. 1 or 2 an hour still low. And then I started having some spotting, and I was like, just worked too hard last night.
Wow.
It's because I need to drink more water.
That is denial.
Yeah.
That's definitely a little denial.
Yeah. So Tio had to drive me to work because I had left my car there the night before because it had snowed. It was like the first big snowstorm, and he had come to get me the night before, or the morning before. And so it was Saturday night now, and he drove me in at 11, and I said, keep your phone on. I don't know if this is anything, if it's going to go away, because I've seen so many people come in contracting and then they go away. And I didn't want to be that girl. So you don't want to be that girl when you're the nurse. And so he's like, okay, see you later, So I go to work, and my coworkers all say, how are you feeling? You look great. I was like, oh, I'm good. I've been contracting maybe like 3 or 4 times an hour now, and I had some spotting. And they're like, you're fine.
Okay.
They don't really.
Yeah.
We had no patients in labor, so they're like, just do your thing and hang out. And if you have to go home early, you have to go home early. So I said, okay. So I worked and had more spotting, had more pain. I wasn't really timing them. I just kind of hung out all night, really. And then 5 o'clock came, and they were much worse. And my charge nurse said, how about you just go sit down for a little bit and see if they,
peter
if
out.
you need to rest, if they'll peter out. I'd been resting all night. I hadn't. There was no patients to be working on.
That's a great night to.
It was a great night to go into labor.
Yeah.
So I went and laid, sat down on a couch for a little bit, and they were not getting any better. So finally I said, do you mind if I leave? And they're like, no, go home. So called Tio again, because my car was there, but I was like, I don't think I can drive. This is really painful, And they were every 10 minutes or so, and I have a 40-minute drive home, and I was like, I don't really want to be stuck outside and driving myself home. So I called him, and he miraculously answered the phone at 5 o'clock in the morning. And I said, can you come get me? I don't think I can drive home right now. He said, okay. So he came and got me pretty quick, drove home, and it was really foggy that morning. It was weird weather that weekend.
Yeah.
And so he picked me up, drove me home. He went back to bed. And I stayed up and watched some TV. I tried to watch my favorite TV shows. I took a bath. I changed positions a lot. And so we got home at 6, and I think I called my midwife around 8. So I did 2 hours at home. I was like, I don't know if I can keep doing this. I don't know if this is it, but if it isn't, I'm going to be upset. So I called the midwife. She called me back pretty quickly. Talked me, through a few contractions, and I don't know if I was putting on a brave face, but she didn't sound very convinced that I was in labor. And so she said, well, how long would it take you to get there? And I was delivering at the hospital that's right down the street. So, because my job is, again, 40 minutes away, and when I delivered, that was a decision I made to see someone closer to home, that if there was an emergency, if heaven forbid I delivered really early and my baby had to be in the NICU for months, then I didn't want to be 40 minutes away from that baby,
Makes sense.
So, luckily, I'm now delivering at the hospital down the street. And I said, I can be there in 30 minutes. Really, it's a 10-minute drive. I was ready to go. But I said 30 minutes because I knew my husband was sleeping and had to put the bags in the car. The bags weren't even in the car, Chloe. I had no car seat in the car yet. I was not thinking I was going to deliver before 40 weeks. I just knew I was going to be 41 weeks pregnant and have to be induced.
This is so typical nurse, mindset.
I don't know. So got off the phone with her. She said she was going to shower. She'd just been at the gym, and she'd meet me there. And so I go wake up to you. I'm like, meanwhile, I'd gotten out of the shower and only gotten a t-shirt on and underwear. And that was as far as I got because I was contracting now frequently and painfully. And every time I'd have to pee or I'd feel like I have to throw up, or it's just, I could deal with the pain, but it was every other sensation that went with it that was really overwhelming at that point then was nausea. I hate being nauseous. I hate throwing up. I hadn't thrown up at all the whole pregnancy. Not one time.
Wow.
So, and then you feel like you got to poop sometimes and you have to pee, and it was just a lot. So I wake up Tio. Like, Tio, get up, put the bags in the car.
And dress me, please.
And dress me. Well, my mother-in-law was here staying with us that weekend, and so she came down because she heard all the hubbub. It was like 8:30 in the morning now, And she's like, oh, how often have you been contracting? I said, I don't know, like every 3 minutes or so. And I'm in the bathroom and I throw up. And she's like, oh, I think it's time to go now. She had 4 babies. I said, yeah, we're going. So
As fast as you
she's like,
can.
where are your pants? I said, I don't know. I think they're on the stairwell. And like draped them over the side of the stairs. She's like, I'll get your pants. And my mother-in-law helped me put my pants on.
Aw, good thing for mother-in-laws.
Yes.
That's good.
So we drive, and it's, again, a 10-minute drive. It's now Sunday morning. So I was like, well, there won't be much traffic. It's maybe 15 minutes with bad traffic. So I should have maybe 3 contractions in the car. I can do that.
So is this like 8:30, 8:45?
It's 8:30 in the morning now. We got up to triage, I think, at 9. So we're at the, desk checking in, and another lady is checking in, and she's obviously not in labor like I am because she looks fine. I'm like, where's the bathroom? Like, in case I have to throw up again. I hate throwing up. I really do.
Yes.
So, so I'm like running up. I had taken a tour. I recommend everybody take a tour of where they're going to deliver because I knew where the elevator was. I knew where to go to get checked in. I knew what triage looked like. Like, I knew what I was expecting. And so that's one piece of prenatal advice I really think people should do.
Because in that heat of the moment, you don't have your wits
No.
about you. So,
No.
and to be totally clueless would be.
Yeah, just of what to expect that way. It was really, I'm glad I did that because I took a childbirth class. I'm a labor and delivery nurse, but I still took the class, and just to get to know people who would be there and maybe a familiar face when I go into labor, that was important to me. But yeah, so take the tour. So then I was like on my way to the elevator, and the lady's like, ma'am, I need to put your bracelet on. So poor thing. She like chased after me. We got up in the elevator. I put my gown on, ready to go. And so the nurses were really great. They put the monitors on for 20 minutes. They said, you got here before the midwife even called to say that you were coming. I said, I'm sorry. It really had taken me, I think, 15 minutes to get there from when I talked to her instead of 30.
Wow, yeah.
It's whatever. She was fine. So they put me on the monitor. Baby looked great. They took the monitor off. The midwife came in and checked me. And she said, what do you think you are? And I said, I don't know, maybe like 4 or 5. Like, that's what I was hoping for. At this point I was exhausted.
You were being realistic.
And I was exhausted because I had not slept before I went to work on Friday night, because sometimes you don't do that if you've had a few days off, and I had a few days off, and then didn't sleep at all Saturday during the day, hardly, very broken up sleep, and then worked all night Saturday awake. So
it's like almost
48 hours pretty much without sleep, and she knew that.
Gosh.
And she's like, well, you're 9 centimeters with a bulging bag, and the baby's low, and I think you're gonna have a baby soon, so good. I'm like, no, I want a nap. Like, I just really wanted a nap. At that point, I was like, I need an epidural so I can get a nap. Not so I don't feel anything anymore. I just really wanted to sleep.
Yeah.
But that was not in the card. She said, no, I don't think so. So I said, well, if I'm not, pushing soon, can you just break my water? I just wanted to be done then, when she said no to epidural. And but that was what I wanted. I did want to do this naturally. I didn't want to be stuck to the monitors forever. I didn't want an IV. So really it was going exactly how I wanted. But in that moment, it was just all very overwhelming. Like, I thought I was going to have more time to kind of, I packed, a cute gown, and I had, a heat pack, and I had music to play, and none of that even made it out of the car. It was all still in the car. I told Tio, I don't need any of those bags. Let's just go.
I just need you to be with me.
Yes, and we need to get into a room now. So I chose a hospital that had tubs for labor. And so the midwife said, well, let me check if the tub room is available. And luckily I knew how far the tub room was from triage. It's the whole way at the other end of the hall.
Thinking so nurse-like.
Yes, it was very far away. So they get me up, get my gown on to stay, and my little nurse comes in, and she's so sweet, and she's new, obviously, because she has another nurse with her. They're, she's getting oriented, and but she seemed very, very capable. But so I go in the bathroom. I get a contraction while we're waiting to leave, just waiting to get my chart or whatever. And I go in the bathroom. I was like, I need to go to the bathroom. And all I could think is, I'm going to have this baby on this toilet. I'm not going to be able to get off this toilet right now. And because the next one was very intense after she had checked me. And so I hear her outside, and she's like, do you need a wheelchair? And I say, yes, because I could not walk to the tub room at the whole other end of the hall. And so she's pushing me. I was like, you need to push me faster.
Yeah.
Please push faster.
I'm not going to get to the...
I'm
going to deliver in the hallway now.
And I didn't want to have a contraction. Oh, sorry. I didn't want to have a contraction in the middle of the hallway. Like, I was so self-conscious about, peeing my pants. Or I don't know what I was going to do in the middle of that hallway. So they get me in the room. The tub's ready. they're all, do you have something you want to wear in the tub? I'm like, no, just take my clothes off. So I just hop in the tub. And at that point, I was in transition, which is, the very intense part of labor where you feel like you're going a little crazy. And it was so hot. The water was hot. And at that point, I just wanted to be cooled off. So I stayed in there for, 2 or 3 contractions, and then my water broke in the water, which was very good. And they're like, the midwife said, well, let me recheck you just to be sure, because I felt like pushing. And she said, yeah, you're completely dilated. If you want to start pushing, you can do it here in the tub, or you can get in the bed or whatever. And I said, no, it's too hot. So I feel like if I had the tub when I was here at home, I did get in my tub, but it's small. It's not a big jacuzzi tub like they have.
Could they have ran some cold water for you?
They maybe could have done that, but at the time I was nauseous. And
you don't know what you want, I think.
Yeah.
It's just all...
It's very, and I've seen women do it, and so I'm like, I should have known that this is what I was going through, but I just didn't. I was in denial still. So I pushed for an hour and a half. The midwife ended up telling me it didn't feel that long. It felt a lot shorter, I feel like. I kept my eyes closed most of the time, so when I finally opened them, I'm like, oh, there's a lot of people here. But it's a teaching hospital, so I allowed an intern to be there, and he was really grateful and really great, and the midwife was there, and I had a birth photographer, and she was there, and my husband, her nurse that was teaching her, and then I think there was one extra person who was maybe there to help with the baby. I don't even know who she was, but
yeah,
so it was, but it was a nice room.
Yeah,
and
it sounds like 6 people, or
and they kept
like that.
They kept it very calm and quiet for me, and then I had the baby, and I got to hold him right away, and after that, it's I'm glad I had a photographer because I don't remember most of it. It was so fast. And
yeah,
it was pretty intense.
Well, that's the natural ways that your body will just sort of forget about that moment.
It really does. I'm like, I know it was intense.
Itself.
I know it felt like period cramps, but I don't remember it being much worse than that. But
well, great. It sounds like you had a great delivery.
Yeah, it really went.
Essentially what you wanted.
Yes, definitely. And I don't think I could have made it any better.
So tell me a little bit about what your plan was to feed Graham.
I had always planned to breastfeed. To try to breastfeed, and I still left it open in my mind that if there were difficulties, if he was sick, if anything was amiss, that I would be okay if he needed formula, but my plan was to exclusively breastfeed.
Great. So you're breastfeeding even today, 3 months later?
I am still breastfeeding exclusively. Yeah.
Fantastic. How is that going?
It's going well. It at first in the hospital he didn't breastfeed until we were in our room, settled in. It took him about 4 hours to really latch on well. And I felt comfortable with the stuff in the hospital because that's what I help moms with every day at work,
Mm-hmm.
So they'd come in, I'd have him on, they'd be like, oh, you look good. Have you done this before? I'm like, no, my first one. But then they find out, that I'm a nurse on labor and delivery, and they're like, oh, okay, well, let us know if you need any help,
Yeah.
So from that point on, he pretty much ate every 2 hours. I never really had to wake him up. He was a good eater. He'd go to sleep, he'd wake up, we'd do it all again. And we just did that the whole time. And I knew that there would be some discomfort. And I got maybe one spot that was bruised, but I never had any blisters, no bleeding, no really any difficulties.
Nipples.
Nothing like that, just one bruised spot. And even when I looked at him, I could tell maybe his latch was a little shallow, but it didn't hurt. So we just kind of went with it. And he only lost 6% before we left the hospital at 2 days old. So we were all happy. We set up our next appointment for 2 days later. And when we went to that appointment, he had now lost 13% of his birth weight.
Okay.
So they brought in 2 scales. We were at the pediatrician for 2 hours that first appointment because they're like, maybe the birth weight was wrong. And I'm like, well, can't do anything about that now, so maybe it was. But I'm like, he's eating, he's pooping and peeing. He looked great. He wasn't jaundiced. He was hydrated. He looked really happy. So that was 4 days of life, and she asked me if my milk had come in, and I have never had milk come in before, so I didn't know what it felt like. And so I was like, what should it feel like? I'm like, I don't think so, because I feel like there would be more. Like, I feel like I'd hear him swallowing more. Maybe I would feel
be
full.
more painful.
They're painful. Like, people say, oh, you're going to get so engorged and they're going to be huge. And I was like, they look normal to me. So I don't know if my milk, I don't think it has. And so I think technically that's a little late. They say 3 to 5 days, but I think 5 days is a really long time to not have your milk come in. And this was the night of day 4 now that I had gone home after that appointment. And they did, they checked his temperature. They did all kinds of things. Blood sugar, all of it was fine. And she said, I think it's just your milk is coming in now. And hopefully by tomorrow when he comes back, he'll be gaining weight now. So she set up an appointment for the next day. and told me to call. She even called me that night to make sure everything was going well. They tried to give him some formula in the office, and he was just so exhausted from them putting him on different scales and having him naked, and he just went, wouldn't even entertain the idea. So I said, I promise he eats. He really does. Like, I felt in my heart that he was eating.
You weren't concerned.
I
it
was
just
not.
that number was alarming to them.
Yes.
So I wonder.
And I mean, I still got emotional
wrong.
about it. I'm like, I don't know. Am I failing? Is this okay? What's going to happen? But so I went home from that appointment. She set me up to go to a breastfeeding support group at the hospital where I delivered, or a hospital associated with them. And she said, I want you to go and see a lactation consultant. And I want them to weigh him, before and after the feed, which is what they did, and see how he's doing. And so I went home and immediately pumped, because I hadn't pumped at all yet. And I got half an ounce very quickly. And I was like, I have milk. It's coming in. I know it's there. And so we gave him that. I went to that class. He gained, I think, 2 or 3 ounces with the feed. And they assessed him and they assessed me. And she said, I think it's just your milk came in late. And, I think it's fine. And so went to the appointment the next day and he had gained 3 ounces.
Wow.
And
overnight.
So they were very happy. We still went we went to a lot of appointments that first month. Just still keeping track of him. And he was always, like I told you, 15th percentile. So he's little, he's not a big kid. But he was always gaining, and he was gaining appropriately, half an ounce to an ounce a day, and always looked great. And so we went with that, and finally they said, okay, we'll see you at 2 months. And
oh, good.
yeah. And then the week before he was going for that 2-month appointment, he got diarrhea out of nowhere, and it was terrible. And I was like, he's got to be losing weight. He feels lighter to me. He had some kind of virus. So now he's 1 percentile.
Oh,
but he's now gaining really well and eating very well and is healthy. And so he's just little.
Aw, little peanut.
Yes, but
So
we get to wear all the little clothes longer now that we have. So it's fine. But he's starting to get, chubby rolls and.
Yeah, getting that meat on him.
Yeah.
So do you think an average mom, without all of the prior knowledge that you've had and the confidence that you had that your milk was coming in, do you think another mom would have been dissuaded by this and maybe just given up and popped in a bottle and said, you know what, if they're questioning, I should be questioning, and so let me go to the guarantee, which is like a bottle?
I think absolutely it would have been, because then you can see how much they're getting and you can be really, confident. Like, he just had 3 ounces of formula, great, or whatever he would have taken back then. But I was very lucky to have that support group that night, because they wanted me to continue to breastfeed, but then to supplement in between, just to make sure that he's getting something. But I knew he was, and that support group showed me that he was, and that was good. Plus, it just got me to see, I think there were 3 or 4 other moms who'd had a baby that week that I did that were there, all getting help. Great. And it was just good to see other people
going through the same
thing. Yeah. And so it took him 3 weeks to get to his birth weight again, but the doctor was really great. I was lucky to have a really great pediatrician who was very patient with us and felt good as long as we were coming and getting him evaluated. And I kept going to that support group, and I still do I'll still go every couple weeks now just to check in and see how he's doing. But he's finally over 10 pounds. So,
yay, Graham!
Yeah. And it's hard. I mean, it's hard being attached to someone all the time, especially at those first few days. You're like, I just want to not be attached. I want to, and then you feel guilty, because you're doing this thing. And for me, I set my mind to it, and I'm going to do it. I want to do 6 months exclusive, and then as long as he wants to after that. And that's, a goal that I've set. I've already made it halfway there. I said it's not going to be forever, Yeah. And I told myself you can't quit on a bad day, because there are bad days breastfeeding where you're just like, the baby just seems hungry all the time, but they go through growth spurts, and it's been important to me to educate myself on when he might be doing that and why. They breastfeed for other reasons, because they need comfort, or they need or they, he does it to go to sleep a lot. I know he does, and some people don't agree with that, but I know he does it when he's tired and he wants to go to sleep, and then he falls asleep and we're good. And, that makes me happy. But I can now pump and leave the house for a few hours at a time. I could leave longer, but I choose not to. I don't go very far from him. Usually just 3 hours at a time. I'll stay out and come back, and he'll eat and be happy.
And all is well.
All is well. I am soy and dairy free now. The pediatrician thinks he might have an allergy to that, so that has been a challenge.
So tell me a little bit, what were his symptoms that he experienced that made you question Or made the pediatrician question allergy?
It all happened at the same time that he got diarrhea, and cow milk protein allergies and viral GI illnesses have almost exactly the same symptoms. So I don't know what fixed it, if it was just the virus going away or if it is the allergy, but we're treating it as an allergy too because he did have green stool before he got the diarrhea, and that's one of the things. He had reflux, and that's one of the things, congestion. He had no skin problems, though, which I'm thankful for. A lot of them get eczema when they have an allergy to cow milk protein. And then he was just generally fussy when he was a little baby, but most of them are. And she just had said, well, maybe you should cut out some dairy and soy if you can, just as a suggestion to keep him from being fussy. And at that time I went, almond milk in my cereal, and I did dairy-free Ben & Jerry's ice cream, and, tried to not use so much cheese. But I was still eating dairy things. I just, cut back a little bit, and he seemed to get better. But then he had normal stools, and he was a happy baby, and then all of a sudden it went green and diarrhea, and it just went downhill from there. But so since then I've been pretty strict. You have to read the labels. You have to, because soy's in almost everything. Really, truly.
Yes.
It's very sad. But I'm part of a great group on Facebook of moms of kids with cow milk protein allergies. They're based in the UK, most of them, so a lot of their products I don't have here, but it's been great to get recipes and ideas and just some support. So really, in this day and age, it's great to have support no matter how you get it, online, groups. Friends who've had babies recently too are great to have, to ask questions and just to be like, is this normal? Like, I've never Googled so much in my life. And some of that's bad. You don't want to Google too much.
Right.
Because then again, as a nurse, I'm like, as a nurse, I'm like, oh, should I call the doctor about this diarrhea? Like, I know they're not going to be able to do anything. And really they didn't, but they checked him. And I said, I know he's lost weight. And so they had me, recheck his weight a few times again. And so it's hard, but support is, paramount to success in breastfeeding, I think.
So tell me a little bit about how sleeping has been for Graham. How is the breastfeeding at nighttime?
I co-sleep right now, which is not what I had intended to do so much. But for me, it just worked for us right off the bat because he eats a lot at night, even still. Those first, of course, when they're setting up their milk supply, it's every 2 hours, and 2 to 3, and if they don't wake up, you have to wake them up to make sure that they're gaining the weight that they need to. But now that my milk's in and he's gaining weight appropriately, he'll usually go to bed between 8 and 9. We've gotten on more of a schedule with that, so we do a bath around 7. He'll eat, we'll play a little bit, and then I can tell when he's getting sleepy, and I lay him down, and he'll usually sleep from 8 to 9 until 12 or 1. So a good 4-hour stretch at the beginning. He had been waking up to eat and then going right back to sleep for another couple hours. But now he's at this stage where at 2 to 3 a.m. he just thinks it's time to be awake. And so he's eating a lot and flailing around a lot, I call it, and just generally being awake. And so I'm trying to maybe get through that, and hopefully it's just a stage right now. But it's been pretty exhausting. And then he'll usually take a nap in the morning. So I think it's just something he's going through and just trying to sort himself out. For me, it's not that big of a deal because I used to work nights. So for me, being awake all night wasn't that big of a stretch, and I'm good at napping during the day.
Yeah.
So when they say nap when the baby naps, it's really true. If you can do it, do it. Because at nighttime, you have no idea if they're going to stay awake all night, if they're going to sleep, if they're going to be fussy, if they're going to want to eat all night. It comes and goes. They're not machines that do the same thing every day, So for me, it's been just a learning curve and was going with the flow. I still drink coffee because I need to.
Yeah.
And that's okay.
Yeah.
But it's been okay.
I've been told that having a newborn is kind of, it's like day and night doesn't matter.
It doesn't.
I mean, it's all one at that point.
And you can't train them at this age. You just can't just sleep. You can do a routine as much as you want, and they could care less most of the time. But just to get in that habit yourselves, to try to be consistent. And then I go to sleep when if he goes to sleep at 8 o'clock, I'm in bed with him at 8 o'clock. It doesn't matter what else needs done.
Yeah.
At this point to me.
Are you co-sleeping?
Yes.
Oh, okay, nice.
We do co-sleep. He has his own spot in the bed, but he's right next to me. So I've gotten really good at breastfeeding on my side. It's usually how we fall asleep.
Yeah.
And sometimes I just sit up because I have to stay awake, Sometimes I'm so tired. But, yeah, it works for now. It's not going to be it's not going to be forever. So I'm just cherishing it while I can and enjoying it.
Yeah. So tell me a little bit about, you could tell me how you met your husband and how his role has been in Graham's life. How is he helping you during this time of, trying to figure out what is Graham's schedule?
Yes. We met in the Army. I was a labor and delivery nurse and he was an LPN on the labor and delivery floor. So when I talk about work, he kind of understands still, what's going on. And when I talk about, that kind of stuff, baby stuff, and, he's pretty good at it. And I was his boss, and we were together in Korea for 2 years, and then we both got out at different times. But so we've been moving around together since then. He's in school now full-time in Philadelphia, so that's 3 hours away by car, which as an Army couple, former Army couple, to us isn't that bad.
Okay.
It could be a lot worse.
Yeah.
Other people have it worse. They don't have a
lot.
support system at all. They're by themselves totally. But I have my mother-in-law, I have my husband, I have my family in Pennsylvania, so they're not too far away. But most of the time during the week I'm by myself with the baby, and at first it was just surviving, just trying to get through, trying to make sure you eat, making sure you drink enough water, making sure you rest. The rest of it just kind of just waited until I was ready to take care of it.
The cleanliness of the dishes and
did lots of disposable stuff. But Tio was there. Luckily, the way the baby came when he was first on his break, he was there for the first 3 weeks of Graham's life, which was wonderful to have that help. He would feed me, with a fork when when I was breastfeeding and getting things settled in. So he was instrumental in my success the first 3 weeks, which are the hardest, they say. And now he's been able to come back frequently, so that he's here. And when he's here, he's very helpful. And mostly he's just my support system. We talk on the phone and we send pictures. And I know he misses him and he wishes he could be closer. But when he is here, he makes the most of it. And we know that when he's done with school, it'll be better for our family. So it was important for us to have him get it done now when Graham's a baby. And so then he'll be there when he's bigger and, doing more things.
Yeah.
So it was just the decision we had to make for us. And that made the most sense to us at the time, to send him off to school now and be done.
That's great.
So.
How about, you'd mentioned briefly that the first 3 months are the toughest. Did you experience any postpartum depression or anxiety or anything like that?
I don't think, when I went to my 6-week follow-up, the midwife asked me the same thing, and I don't really feel like I got more depressed than anyone else would in the winter when you're by yourself with a baby. I didn't have any feelings of I can't get out of bed, I can't take care of myself or the baby, that kind of thing that goes along with postpartum depression. My big anxiety was kind of, I don't know, to me it seems silly, but it really was in my head that when I take him somewhere and leave that place, that I felt like I forgot him. Like I'd have to turn around. Even though I just put his car seat in the car and I know he's there, I would have to double check. Because then in my head, if I really did forget him, the police would be called and they would take my baby away from me. That's the only, and it still kind of happens still.
That's so funny.
Yeah, that's the only anxiety I got. And then I heard that a lot of other women feel like they're going to hit their baby's head on the door frame. I've had that happen too, where you're like, oh my gosh, but you don't. You don't hit your baby's head on the door frame, but you feel like you're going to every time you go through a door.
Wow.
And it's so weird, yeah.
Well, as a labor and delivery nurse, I remember having sort of like dreams or thoughts. What if I drop someone else's baby while I'm like holding them? Or if I don't know, like you think, if I deliver the baby and what if it slipped out of my hands? Or what if I'm patting them on the back and I lost control of the baby? Because, that's everyone's biggest fear.
Yeah.
And so when it does happen to a mom, if, the baby falls out of the car seat or something, it is traumatic for a mom. And I think that's because it is such a big, common fear. It's also really common to actually new moms being in a sort of a state of night and day delusion, like, really being sleep deprived. There have been moms that have forgotten their children. And
it's a new thing, putting a baby in a car seat. Like I haven't done it before. So in my brain somewhere it said, you need to make sure you didn't forget your kid just now. Even though I know I did.
Or like walk out of your car and forget that the baby, I have to grab the baby. Yeah. He's not inside,
I can see, it's so sad when that happens, that people forget their kids in the car and something terrible happens. But I could see how it could happen.
Yeah.
You're that
Right.
You're that
Even to
tired.
not a bad mom. You know,
No.
it could just happen. It could just happen, but
You're that
not
tired.
to increase anyone's anxiety.
No.
So what are your next steps preparing to go back to work? Are you pumping? What's your schedule like?
I have 3 more weeks before I go back to work, and so once I found out about the cow milk protein allergy, I had to sadly throw out all the milk that I had already pumped, which wasn't a huge stash, but was enough to make me feel comfortable. So now I'm pumping once or twice a day, storing maybe 4 to 6 ounces a day, which in reality, you don't need a huge stash to go back to work. It would be nice to have, but I'm not planning on being on vacation away from him, for days and days. So I've just been doing that, and it's been working out. I'll pump after I feed him in the morning is usually the best time. I get a few ounces then, and then at some other point during the day when I feel like he's only eaten off one side and the other side feels pretty full, I can pump and get a few ounces.
That's great.
Mm-hmm. And then label it and put it in the freezer, and it's waiting. But
Okay.
yeah.
Do you have any big takeaway tip or like a favorite item that you think new moms should purchase or have around?
My baby hasn't been very good at any of the containers, really. He doesn't really like to stay. He's most entertained by people right now. Like the toys he could care less about. Right now he's starting to become more aware, but for those first couple months, they don't know anything but you, really, and they don't care about anything but you. So for me, I just really, I guess, just have the support is my biggest takeaway. Set up your tribe, whether it's other new moms or your mom, your aunt, your whoever, your coworkers have been really great for me. I had stock my freezer party as my baby shower here because I didn't really need things. I didn't really need a lot of stuff anymore. So my coworkers baked for me and cooked for me, and I've had food set up for me that I've been eating off and on since I delivered, and it's been really great. So I would recommend doing that. It's either
Great.
yourself prepare something or have your friends do it for you. And just have fun, enjoy it. It's like nothing else, but it goes by really fast.
Yeah.
So, yeah.
All right, Becky, thank you so
No
much
problem.
for being here.
It's
This has
been my
been
pleasure.
really great. I think a couple of the takeaways would be first off, go to your hospital tour. Also, setting up, some friends in the area, or even having an online community like the Pregnancy Prep, but being in community with other moms that are going through what you're going through, and those local breastfeeding classes that are connected to the hospital, those are really good too, because then you can sit and actually have someone look at your latch, making sure that baby's getting enough food and that you're making enough milk. And it'll also give you some peace of mind, make you feel better too.
And community. You meet other moms who might be a couple months down the road where you were,
Yeah.
and you can be like, okay, it'll get better. Or you hear them ask questions and you're like, oh, that's good to know. And things you didn't really think of. It's been really great as a community too.
Great. So it's been a pleasure talking to you today. Have a great day.
Thank you.
Bye.